Illinois launched the largest housing assistance program in the nation in response to the COVID-19 pandemic, dedicating over $300 million to help households pay their rent and their mortgages in this extraordinarily challenging time. Today, we've reached a new milestone. The Emergency Rental Assistance Program has approved nearly $200 million in rental assistance to sustain 40,000 Illinois renters and landlords during these extraordinary times. Because of this program, tens of thousands of families may have a more peaceful Thanksgiving knowing that their housing is secure. And as of this week, more than $40 million has been approved from our mortgage assistance program, on track to support 10,000 homeowners by the end of 2020. In fact, after meeting the needs of our mortgage owners, we have enough additional funding remaining to support an additional 10,000 renters and their landlords, bringing the total support for rent payment to well over $200 million by the end of this year. I'm grateful to the IHDA Executive Director, Kristen Faust, and her entire team for their dedication and commitment to stretching the reach of these funds to support even more Illinoisans in need. Of course, I wish all of these support amounts could be so much higher. Tens of thousands more people applied for assistance than we have the capacity to serve at the state level, as the nation faces a massive housing instability crisis due to this pandemic. I want to remind all Illinoisans who are struggling to pay their rent or their mortgage, whether or not you applied for this program. We have an eviction protection order in place for middle and lower income individuals and families that runs through at least December 12th. The form that renters need to complete for eviction protection can be found on www.ihda.org. That's ihda.org. Here in Illinois and across the country, renters, landlords, and homeowners are experiencing immense pain. And if the nation's largest state-developed assistance program, the one we have here, is hearing from more than twice as many people as we can actually help, well, that's a sign that we need serious action on a national scale. My administration will continue to call on the United States Senate to come to the bargaining table with a real willingness to address that pain, the pain of the families, businesses, landlords, renters, workers, states, cities, school teachers, healthcare workers, restaurant owners, and entrepreneurs. It's pain that transcends political party. Americans deserve more than this, and we need more than this. Today is the first formal day of our temporary Tier 3 mitigations. Remember, the core philosophy here is that if we all stay home as much as possible, if we all avoid the trips outside the house that we don't need to take right now, we can fight this recent surge and turn things around for our healthcare workers and hospital systems who are facing an increasingly dangerous situation across the state. And we can potentially pull back on these mitigations for everyone before the December holidays. I want to offer a reminder about who we're talking about when we say healthcare workers. These are real people, doctors and nurses and cafeteria workers and sanitation workers and other essential workers who never thought that they'd end up working double shifts on multiple days in the same week for weeks on end in the middle of the worst public health crisis in over a century. They too have families that they worry about. They too are exhausted. They come home at night or early in the morning and have to strip down and wash their clothes immediately to avoid spreading COVID to their families. They deserve our respect and our help. People like Betty Coonrod, an infection disease nurse at the Adams County Health Department. Betty works 80 hours a week, 7 days a week. She's exhausted, and yet Betty still finds a way to go above and beyond to counsel COVID patients in their time of need. Or Amy Marley, a communicable disease nurse and public health administrator with the Lawrence County Health Department. Amy spends every day running COVID tests, caring for patients, and reporting out numbers to the public. And she's been doing it for what seems like an endless number of months, somehow always with a positive attitude. And then there's Debbie Freiberg, a retired nurse who signed up with the Rock Island County Health Department to be a volunteer contact tracer way back in March. And she's been doing it nonstop ever since, logging nearly the same number of hours as full-time staff there. Debbie's colleagues say she's a rock star in their department, completely committed and always kind, working hard to educate people across the county on how to deal with a positive diagnosis. When Dr. Ezike and I get up here and we ask you to wear your mask, avoid gatherings, and to follow the public health mitigations, we're not asking you to do it just for us. We're asking you to do it for Betty and for Amy and for Debbie and the thousands more like them across the state who are doing everything they can to keep the rest of us safe. When we get to the other side of this pandemic, let's make sure that we did everything in our power to support their efforts and to bring as many of our neighbors as possible over the finish line. Thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike. Doctor.
Thank you, Governor, and happy Friday. I want to take a minute to reflect on the evolution of this pandemic. Not the science or the numbers, but how we socially responded since the first case here in Illinois that was reported way back January 24th, 2020. 10 months ago, we were all waiting to see what would happen after that first initial case. Would we see more cases, or would it be just that one from the individual who had recently traveled? Then we saw the second case here in Illinois, and that was the first person-to-person transmission in the United States, and the alarm started to sound and quickly grew as additional cases were reported day after day. Healthcare workers and public health professionals worked around the clock to learn as much as possible and share it with the public as quickly as possible. And during this fretful time, we came together to support one another. And we reached out to others, and we called, and we checked on each other's welfare. We didn't look for who we could blame, but offered support to one another instead. When states across the United States and even some countries around the world began the stay-at-home orders, we all wanted to do whatever we could to prevent additional sickness and deaths. And it worked. And the number of cases decreased, as well as the number of hospitalizations, as well as the number of deaths. They decreased dramatically. But as we've seen our numbers trend in the wrong direction now, unfortunately, that support that we initially saw has faded, and in some cases is absent. Just as real as the virus is, so is the COVID fatigue that is accompanying it. And we're all tired of this virus, and we're tired of staying home, and we're tired of denying ourselves our common pleasures. But instead of blaming the virus for these concessions that we've been asked to make, we're looking to blame one another. And so I just want to urge people to be kind. Doctors, nurses, respiratory therapists, public health professionals, you heard about Miss Betty and Miss Amy and Miss Debbie. All these people and so many others continue to work around the clock, and they're continuing to try to prevent additional illnesses. There are absolutely zero easy answers. There's no simple equation that says if you do X, then Y gets to happen. There's still many unknowns, there are many variables, and so there's no solution that's 100% effective, especially when it depends on every other member of the community to buy into the plan. For every person who is screaming that they have to have in-school learning, you have others who are adamantly against it. For every person who wants to have dinner inside of their favorite restaurant, there are those who are worried about their own personal safety and their lives. None of us has a crystal ball, and while it's often said that hindsight is 2020, we are still in the year 2020, and you and I, all of us, can't wait to put this year 2020 in the rearview mirror. But until then, let's make decisions with the information, with what we can see right now. I'd ask for all of us to have patience and compassion for those with whom we may disagree, and to understand that this is an extremely difficult time for everyone. Nobody is getting through this unscathed. I think Dr. Singh said it very well yesterday, that this is a traumatizing mass casualty experience for all of us. Today, we are reporting 13,012 new cases of COVID-19 for a total of 634,395 cases in Illinois. Sadly, we're reporting an additional 126 lives lost, for a total of 11,304 total lives lost to this deadly virus. Overnight, 6,111 people were in the hospital with COVID-19, and of those, 1,196 were in the ICU, and 604 were on ventilators. In the past 24 hours, more than 116,000 tests have been reported for over 9.5 million tests thus far in Illinois. As we head into the weekend, I encourage each of you, offer kindness and support to your fellow neighbor. We all desperately need it. And of course, we also need you to wear your mask, and we need you to keep your distance, and we need you to get your flu shot, and we need you to plan a very small, household-only, safe Thanksgiving. Thank you. Hola y buenas tardes. Quiero tomar un minuto para reflejar sobre la evolución de la pandemia, no de la ciencia ni de los números, pero de la manera como respondimos desde que se informó el primer caso en Illinois el 24 de enero de 2020. Hace 10 meses, 10 duros meses, todos estábamos esperando a ver qué pasaría después de ese primer caso. Preguntamos si iba a haber más casos o sería solo un caso de alguien que viajó recientemente. Cuando vimos el segundo caso en Illinois, fue la primera transmisión de persona a persona en los Estados Unidos. La alarma comenzó a sonar y creció rápidamente a medida que se informaron casos adicionales. Los trabajadores médicos y los profesionales de la salud pública trabajaron las 24 horas del día para obtener la mayor cantidad de información y compartir esa información con el público lo más rápido posible. Durante este tiempo terrible, muchos de nosotros hemos dado mucho apoyo de nuestra familia, amigos y vecinos. Nos buscamos a quién culpar, sino que ofrecimos apoyo y prestamos un oído para escuchar. Cuando nuestro país e incluso otros por todo el mundo comenzaron con los órdenes de quedarse en casa, todos queríamos hacer todo lo posible para prevenir enfermedades y muertes adicionales. Y funcionó. El número de casos, gente en el hospital y muertes bajaron drásticamente. Pero como hemos visto números ir en la dirección mala, desafortunadamente el soporte que vimos inicialmente está ausente. Todos sufrimos de fatiga COVID y estamos cansados de quedarnos en casa y no ver a nuestros amigos y a familiares. Pero en lugar de culpar a este virus, estamos empezando a buscar culpar unos a otros. Quiero instar a la gente a que sea amable. Los médicos, enfermeras, trabajadores de la salud, profesionales de la salud pública y muchos otros continúan trabajando las 24 horas del día para prevenir enfermedades adicionales. Quisiera pedir que todos tengan paciencia y compasión por toda la gente en Illinois. Hoy estamos reportando 13,012 casos nuevos de COVID-19, para un total de más de 634,000 casos en Illinois. Desafortunadamente, eso incluye otras 126 muertes, para un total de más de 11,300 vidas perdidas en ese año solo. Desde anoche, 6,111 personas estuvieron en el hospital con COVID-19. De ellos, 1,196 pacientes estaban en la unidad de cuidados intensivos y 604 personas estaban en ventiladores. En las últimas 24 horas se han reportado más de 116,000 pruebas, para un total de más de 9.5 millones de pruebas hechas aquí en Illinois. A medida que nos acercamos a este fin de semana, animó a todos a que ofrecen amabilidad y apoyo a nuestros vecinos. Por favor, quédense en casa lo más posible para ayudar a frenar este virus. Muchísimas gracias y nunca se recuerdan los 3 M's, usa su máscara, mantenga su distancia y lávese las manos. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you, Dr. Ezike. Throughout the last 9 months, I've tried to make it clear, as has Dr. Ezike, as well as people like Dr. Anthony Fauci and other public health professionals, that COVID-19 is a disease to be taken seriously no matter your age. Because even if you don't personally face a severe case, you may transmit it to someone who would. Because even if you're young and healthy, without any secondary conditions, there are no guarantees. No one knows this better than our next speakers. I'm so grateful for this family's willingness to share their story, though it breaks my heart that they have to share that story and that they have such a story to tell. The family who will join us in just a moment reached out to my office amidst their grief in an effort to save other families from experiencing the same horrible loss, and with a desire to honor the memory of Danny Rubin Cater, a wonderful wife and daughter. With that, I'd like to offer the floor, the screen really, to Tina and Bob Rubin, who lost their beloved daughter, 30-year-old Danielle Cater of Bloomington, to COVID-19 earlier this month, as well as Tim Cater, Danny's high school sweetheart, who turned out to be her husband. They have some important words for everyone going into this holiday season.
Thank you, Governor Pritzker, for inviting us to allow us to tell our story. Tim and Danny had been married about 6.5 years. They lived in the Bloomington area. They found their dream house. Their careers were off to a great start. Everything was going according to the plan that they had originally mapped out. And then in late October, COVID struck.
It just happened so quickly. So on a Tuesday, she lost her sense of smell and taste. And so we immediately quarantined, and she got tested that next morning. And that was really her only symptom until test came back positive on that following Saturday. And over the weekend, her breathing got a little bit harder, but nothing that we were ever concerned about. We just thought it was part of being sick and that we just needed to get through it. And it wasn't until we bought a pulse oximeter on Monday morning that we realized just how bad it was. Her oxygen levels were really low, and we knew we needed to get her to the hospital, that this wasn't something that we should be trying to take care of at home. And so Monday morning, we took her into the hospital, and they put her on a BiPAP, which she responded to. You know, she was texting us from the hospital, telling us that her oxygen levels were back up to normal. And, you know, we were all relieved. And later that night, her oxygen levels dropped. They put her on the ventilator, which it kept her oxygen from going down further, but it never came back up. And then they did an ECMO procedure, which it was shortly after that that she passed away on Tuesday morning.
So you can only understand the devastation that our family has had through this. We lost our only daughter. Tim lost the love of his life. But through this, we want something positive. You know, these aren't just numbers. They're not just statistics. These are real people with real lives and real futures that have been stolen by this virus. Coming forward, we want to take all this negative energy that we have right now and try to turn it into something positive. If we can have one person stay home, do something positive for someone else by making sure they quarantine when they are sick, following all the CDC restrictions. I know everybody's tired, but you just have no idea the devastation losing someone brings to a family. And we really appreciate the opportunity that the governor's office, the governor and his team has allowed us to tell our story and maybe make a difference in fighting this horrible, horrible virus. So with that, if Governor Pritzker would like to take over, thank you.
Thank you very much, both to Tina and Bob and to Tim. Thank you for sharing your story. It's a parent's worst nightmare to have to bury your child. And Tim, I am so sorry for the years of happiness that were stolen from you. You and Danny deserved a full lifetime together, but I'm really glad that you found so much joy in the time that you did have. My heart breaks for Tina and Bob and Tim, for each and every person across our state who mourns someone gone too soon. Maybe we all ought to take a moment to recognize the losses that have occurred all across this state. May their memories be for a blessing to those who loved them and to all of us. And before I take questions, I also want to note that Tina and Bob and Tim have created the Danny Rubin Cater Memorial Fund for COVID care. It's a program that will provide COVID-positive residents in their community with care packages to help them monitor their temperature and their oxygen levels at home. Remember, you're alone. When you're in isolation or quarantine, you're alone. So to learn how you can help, you can visit MaconCountyGives.org. I'm going to spell that, M-A-C-O-N, that's Macon County Gives.org. Thank you, and I'm happy to take questions from members of the media.
I wonder if we might get an update on the vaccine, and maybe it's Dr. Zike, how, as well as you, how is Illinois preparing for the FDA approval of the various vaccine candidates? And I have a couple others on that same thing.
Yeah, so we all heard the exciting news today that that Pfizer is going to move forward and submit their full application to the FDA. And so if everything goes smoothly, I know the FDA is going to be reviewing this rapidly. We know that that process can take as little as 2 weeks, maybe up to 4 weeks. And we already know that we heard from directly from General Perna that as soon as FDA approval is granted, you know, the next day they would start shipping out vaccine. So of course Pfizer is the vaccine that was going to have to be held at the ultra cold storage. And so a lot of planning, trying to identify all the locations for ultra cold storage that we have in the state. We've also gotten ordered 20, we have 20 separate contraptions that can hold vaccines at that ultra cold level. And so those 20 freezers, if you will be placed in all of the 11 regions to make sure that there is access for every part of the state to the vaccine. We know that the first amount of vaccine that we'll be getting, unless things change, we were initially told that we would get about 400,000 doses. And so that is the number that we're kind of working with to identify how we will partition that out for, again, for the first phase, which is phase 1A, it's supposed to be our healthcare workers and first responders. So we'll feverishly working with excitement to know that really, if things work out well in terms of the safety and the efficacy as reviewed by the FDA, that we really will get to operationalize and be have vaccine in our state to start immunizing our phase 1A participants, which again are our healthcare workers and first responders.
And how will it be distributed? It will be through hospitals, or?
We'll start with the hospitals again, who will be able to.
Hospitals, is that, I mean, as far as distribution?
Yeah, so we have major hospital partners in the different regions. We have what we call our regional hospital coordinator, who is like our flagship hospital in each of the 11 regions. And so that will kind of be like ground zero in the different regions as we try to get that vaccine to all the healthcare workers for that first level of distribution and allocation.
And Jim, one last one on vaccine. Should we be concerned at all about special use authorization and a, quote, rushed coronavirus vaccine?
Right. Well, I think everybody understands the reason why it was rushed, being in the midst of a global pandemic where we are losing countless, just in our state alone, we're losing 600 people every single week. That is the reason that it is using this emergency use authorization as opposed to the normal BLA, the biologics license application. But I think we all know that everyone involved with the FDA is going to be taking the utmost precaution as they're reviewing the application to make sure that it's not the same as the EUA for a drug, which you're thinking about people who are already struggling, they have the virus, they could die without this possible help. We know that we're putting this into the arms of healthy people who are not ill, and so that level of caution and concern and regard is obviously being taken to make sure that it exceeds the level of safety that we would need to make sure it's worth it to put healthy people, to put this medication into their body.
Doctor, I was looking at the website today. 22 available ICU beds in Region 7. It's been hovering around 24 for the last few days. I mean, how do you describe 24 or fewer ICU beds in a region with 2 counties, 800,000 people? What are the realities in terms of where we are there?
I don't think I have to explain that to anyone. I think it's a dire situation. Their positivity is still going up, which means that we're going to continue to see more people infected. Of course, not everybody infected is going to need a hospital bed, but you know that there's going to be a small percentage of those that will need hospitalization. They will need either a medical surgical bed, and some will need an ICU bed. So the situation is dire. Of course, we're already trying to work in a collaborative fashion so that people don't think just if you don't have a hospital bed just in Will or Kankakee, obviously there are surrounding neighborhoods, surrounding counties that there are some beds. So you can imagine that there will be collaboration and transfers, and many hospitals, just as they did in the first wave, are going to open their doors wide open to take on patients that are going to be needed. We are not at the point where we're going to have anybody just flailing in the hallway because we can't get them a bed. No. And the whole point of the increased mitigation in the Tier 3 is that we don't get that, because that is a real possibility that has happened in other parts of this country and other parts of the world. We're not going to let that happen in Illinois, but it takes all of us to make sure that that doesn't happen.
Dr. Zike, Northwestern Memorial data manager says occupancy right now is 76%. At the same time last year was 82%. Rush Hospital says there's brisk and plentiful hospitalizations, but patients are leaving as quickly as they come in. Are hospitalizations up because to administer remdesivir you have to be in the hospital?
Remdesivir is given in the hospital. It is a minimum of a 5-day infusion. So we have said that before, that we are happy because of all the advancements and the medical advancements that people have made in terms of all that experience that was garnered from the first wave, that they know so many things. Just this afternoon, we had a critical care team talking with hundreds of medical providers across the state, nurses, doctors, and respiratory therapists, talking about the proning and different things you need to know about taking care of critical COVID patients. So we're sharing that information. We're trying to use all the experience that we have so that we can have better outcomes, so that the fatality rates are lower, so that we can try to do the right things earlier, use the right medicines earlier to prevent some of these frequent complications that we saw in wave 1 with clotting and strokes and other thrombotic complications. So I am glad to see that the turnover is greater, that more people can get out as opposed to staying these extended, stays on the ventilator and then succumbing. So these are good things, but the problem is with the sheer number of people that are getting infected, everybody might not have that favorable course.
So people who've been pushing this online, this idea that, there's plenty of space in hospitals, they're not looking forward. That's what people are pushing, is the idea that, well, gee, if we're only at 76%, we're doing fine. Remember, there are a whole bunch of people that are in the hospital for things that have nothing to do with COVID. So what you're looking at is directionally and the speed at which COVID patients are filling up these beds, right? So we're trying to look forward weeks, right? So that we don't end up at Christmas time with the situation where they're at 105%. And so I know, though, that I've seen many of these posts about, well, gee, this hospital has only 76%, or this hospital has only 80% of beds filled. That's not a good way to look at it. You have to look at what the trajectory is, how fast it is that they're likely to fill up, how fast they're coming into the emergency room and ending up in a bed. Believe me, if you call, and I have, the chief medical officer at Northwestern Hospital, you will hear that it is getting to a point, they're managing, because they're one of the best and biggest hospitals around. They're managing right now, but they can see that trajectory going forward, and they're very concerned.
I know you talked, excuse me.
Can I just share?
Oh, yeah, sure.
We had 3,000 patients in the hospital.
Dr. Z, hold on.
I just want to put this in perspective. We just reported over 6,000 patients in the hospital today. October 28th, how long ago was that? That's like barely 3 weeks ago, we had 3,000. So just think 3,000, over 6,000 in just 3 weeks. That's the kind of trajectory we're seeing. So if you think there are some beds now, yes, there are some beds now. But if we go at that pace, how much longer will we have a bed?
And the hospitals that are having the greatest trouble, I might add, are, and it's every hospital, but the ones that are having the greatest trouble are the ones who are in exurban and rural areas where they don't plan to have so many people show up in the hospital or show up in an ICU bed, and so they're struggling.
You said Tier 3 mitigations may be lifted before the holiday season if all goes as planned.
Hopefully.
Have you thought, since we're testing more people, we are testing 10,000 a day now, 116,000, which is good. Have you ever thought about changing the metrics from 8% positivity to, say, 15% positivity? Because
as what's allowed, you mean?
Yes, for, to open up.
No, that's crazy. I think about the WHO number, right, is 5%. If you're below 5%, you're in sort of the green zone of positivity. That's still not as good as it should be, but 5% is at least, a number that I think we would all shoot for. 8%, remember, was a number that we said, well, gosh, we don't think we're going to hit 8%. This is when we were at 3.5% and 4%. We're not going to hit 8%. That's just going to be a fail-safe. I used that word a lot back then. 8%. Well, gosh, now we're at 16. In some places, 19% in some regions, and across the state, about 14%. So we're in a serious situation now.
We'll take one more in the room.
I know you talked about Mike Madigan yesterday, but I was not here. But the question is, when is the last time you spoke to Speaker Madigan? And why don't you tell him to resign?
Well, I made my statement yesterday about that, and I'd say another thing, which let's see, when did I speak with? Remember, there is regular business like the budget, for example, that has to be done, and so at a minimum, I know, it was just before we put in the Tier 3 mitigations, as I do every time. I call up the leaders of the caucuses and let them know and make sure that they have all the information that they need so that the legislature is informed. And I can get feedback from the leaders. That was the last time. So when was that?
Monday.
Monday, and so the time before
But did
that
you
was
say
the
to him-
leaders meeting.
Why don't you personally call him and say, it's time to go?
Well, I said it publicly. Why do I need to say it privately? I said it yesterday. I said that he needs to stand up and answer every last question right now, or he should resign. I mean, the people who hold high public office have an obligation to be transparent, and it was made all the more apparent to all of us 2 nights ago when the information about these indictments came out. You know, this is the time, right now. Now is when, and I think many of the legislators are coming out and saying the same thing.
We'll do one more question in the room, and then we got to go online. No one? Okay. Barb Markoff, the Illinois Veterans Home at LaSalle has seen a surge in cases and deaths since the beginning of the month. Some families of residents who do not have COVID are concerned about the compassionate care visits that continue at the facility. Others believe that this outbreak was caused by staffers who were exposed in the community outside of the facility, and that leaders in that community are not enforcing COVID mitigation measures, even though the positivity is high in the community. What will it take to crack down on those who aren't following the rules in LaSalle County?
Well, we're trying to do that. First of all, you know, there are the mitigation measures that we put in place that we've asked local officials to enforce, and I think many of them are getting the message now. You've seen Naperville and other places in the state are contemplating enforcing mask mandates and other mandates that we put in place. In terms of what we can do, I mean, one of the things that we do is we're testing every single person that goes in and out of the nursing home, particularly that veterans home. And of course, we've tested everybody in the nursing home and continue to test until we find that the cases are gone. So we're going to, these folks are getting tested on a very regular basis, and the people who are going in and out, the staff people, were getting tested and still are on a very regular basis. That's the best thing we can do to protect the people in the veterans home. In terms of other enforcement mechanisms, I mean, one of the things that you've seen that I think is going to help us out is that, at least in this Tier 3 set of mitigations, we've turned off VGT, the video gaming terminals, which many bars and restaurants were, one of the reasons they were staying open was so that they could fill up those video gaming terminal spots. That's one thing that we're doing to have an effect. Another is that we do have patrols regularly by the Illinois State Police who are issuing warnings, who are giving a second warning and then issuing a citation. And we've called upon the state's attorneys to do their job and prosecute those citations, which are monetary in nature.
Julie at the Wall Street Journal is working on a story about restaurants and bar mitigations and would like you to respond to State Representative Dave Severson, who said there's no proof they were ever really a problem, and the majority of restaurants in Rockford remain, and the city isn't boarding them up, he said.
Well, Dave Severson isn't reading his email even, I guess, because we send out to all of the state representatives, and we'll be happy to make available to anybody that asks us, the many, many studies, both national and international in nature, that are done by very reputable organizations, one recently by Northwestern and Stanford University, but there are many, many others, that show that bars and restaurants are the amplification points for COVID-19. We also have in our exposure data for the state exactly the point that this is the intersection for many, many people, bars and restaurants. Remember, you're in a bar and restaurant or a restaurant typically for an hour, possibly more, if you're sitting down, and people are mostly not wearing their masks. So it's fairly obvious. These are indoor places, not wearing masks, lengthy period of time. The viral load that builds up in places like that are exactly what people say you should avoid, whether it's a bar, restaurant, anywhere else. It would be like in this room if everybody just took off their masks and we doubled up on the number of people in here. Guess what? We would probably have the transmission at least increasing significantly in this room. Everybody here is wearing a mask. Thank you very much. And we have very few people in the room.
Jim Haggerty at the Rockford Advocate. Governor, with the steady rise in hospitalizations, are any facilities seeing PPE shortages or in danger of running out of ventilators, or have those supplies been sufficiently restocked?
Well, I believe that we have restocked everybody, or we've made sure that they have stocked themselves, that they've provided their own PPE. They are responsible. Private organizations, nursing homes, hospitals, and so on are responsible for having PPE. They have to acquire it themselves. The great news is that because we had we never had a second surge over the summer in Illinois, many of those organizations were able to restock to make sure that they could have much more PPE than they anticipated back in March. Nobody anticipated the needs back then. You couldn't. And then behind them, just so you know, we've built a kind of the secondary wall of PPE, and that is at all of the local departments of public health, where both they have acquired their own and we've shipped to local departments of public health. So that's the backup for everybody in the counties. And then the state of Illinois has a very large supply that is backing up, again, those two walls that, you know, in case we get to a point where we need. But we have many of almost everything that we need. I think that the one item that I look at this now regularly, the inventory, the one item that we're still stocking up on is gloves. That seems to be a problem all over the world, but we're continuing to acquire anything we can find. But again, there's a couple of walls before it gets to the state.
Dave McKinney at WBEZ. The latest IDPH numbers show available hospital beds and ICU beds, and they showed a sizable drop in the past 24 hours. Is there a significance to this, or is it merely a daily blip?
Yeah.
Somebody's really paying attention to the data on our website, and I'm grateful for that. So you will see that there are several thousand less available beds, and because we have asked all the hospitals, look, when we have you put in the numbers in terms of what beds are available, we can't just have you say, oh, there are 300 beds available, if you move this over and you did this. We actually need to know how many beds are available that have staff that could actually work it. And so when you put that extra clause that actually you would have the staff to man that bed now, the numbers drop significantly. And so that's the more workable number that tells us that if there's this big surge, of patients coming in today and tomorrow, can you staff it today? And so when you put that on it, the numbers go down. It's not aspirational beds that you potentially could staff, but how many can you staff today? And so those numbers have come down.
When did you make that change?
So we put that information out about a week ago, saying like we want to know what you can actually staff. And so people are adjusting their numbers to be consistent with that new definition.
And just to point out, there's a bit of subjectivity in that, right? Nothing wrong with that. But understand that if you have an empty room that's on a hall and you've got a certain number of staff and you've been serving, I'll just say 10 rooms, and you've got 2 others on a hallway, could you fill the other 2 with the same staff and still manage that? And again, with double shifts and people working longer hours, it's possible. And so there's a subjectivity to it for the hospital when they're judging how many of these beds can we actually staff properly.
Sarah Mansour at Capital News Illinois. Yesterday, Representative Mizaki said the governor and AG Raul should consider filing state charges similar to federal charges filed in Wednesday's indictment. What does the governor think about that?
The governor doesn't have the ability to file charges, and I do not believe that the Attorney General has the ability to file charges, like criminal charges, as she's suggesting.
It's been 24 hours, and the Speaker hasn't called a press conference to answer any questions.
Isn't Representative Mizaki an attorney? I'm kind of surprised at the question.
But I do not know. It's been 24 hours, and Speaker Madigan didn't call a press conference to answer any questions. How long will you wait to make him resign?
Well, there are opportunities, I believe. For example, there is a committee that's been put together in the House. That's one opportunity. The Speaker can hold a press conference anytime he wants to. I'm not the one who's really ultimately the judge of this. Remember that the decisions that get made about who the Speaker of the House is ought to be and should be and are made by the members of the House. I just expressed my opinion about it.
Gaynor Hall at WGN, what support is the state providing for hospitals like Morris Hospital in Region 7 that are at or near capacity?
What supports? I didn't hear.
Yeah, what support is the state providing for these hospitals like Morris Hospital in Region 7 that are at or near capacity?
Sure. I think I don't want to take away from the doctor's answer, but I'll just say, you did hear the doctor say that when hospitals hit capacity, or at least as they're approaching capacity, what they're looking to do is to find, is there a way to take people who are in a less acute condition and perhaps move them to another facility, to another hospital and so on, or to divert folks who might otherwise come to that hospital before they ever enter a hospital to go to another hospital. That's one of the ways, but I'll let Dr. Ezike.
That's accurate. We're playing a little bit of, not to be glib, but a game of checkers, trying to move people where there's available bed. We obviously want to make sure that an ambulance is not taken to that hospital where there are already issues with beds. So that's a conversation that involves IDPH to maybe, if it has to be, that we have to put a place on bypass and not put more, not send more traffic to that location. So those are the things that we have at our disposal, trying to help coordinate transfers, whether it's the higher acuity or the lower acuity, to other hospitals, and then also maybe putting that location on bypass while they try to decompress.
Have any locations been put on bypass?
So I don't have the names, but there have been situations where the ED was full and they haven't been able to move the patients from the ED to a bed because there's not an available bed, and so those requests have been made in many an occasion in the last month or so. So I think we have had to grant that in some states, in some situations. I can't tell you the names now, but I think many requests have been made, and then we've tried to figure out when we just really had to, because that obviously increases transport time for ambulance, and so that affects people's health too when they need emergency care and have to go a few extra minutes to get that.
And I think I'd add on top of the, if I may, Dr. Ezike, in terms of hospital capacity, one of the things, there was a question earlier about remdesivir, and one of the things remdesivir does is it shortens your stay in a hospital. And so when we got the free remdesivir, from the federal government, we made sure to distribute it to places where we knew there would be more challenges, perhaps. And we continue when we get shipments of any sort like that from the federal government. We have one that's coming, I think, that's related to another treatment that's been authorized. We try to distribute it to places where we think there's going to be a higher incidence of people who would stay in a hospital longer, and to places that get less well served, I guess is the best way to say it.
Hannah Mizell, between last Friday and today, IDPH is reporting more than 6,500 new COVID cases in nursing homes. Since the state began reporting that weekly, that is the largest number that it's ever been. What is happening?
I think everyone needs to understand that if our communities are not safe, nowhere can be safe. And so if there is growing disease outside of the walls of a school, of a nursing home, of any workplace, it's hard to keep that place just completely protected. In the case of the nursing homes, the people that come in and out, they're in this community that is full of disease, especially as we already mentioned, we're referring to what happens when you're in a community where they're not supporting the mitigations and they're not helping decrease that transmission. The healthcare workers in the long-term care facilities or in any workplace are not immune to what's in the community, and so that's why it's so incumbent upon all of us to observe these mitigations. Let's get the transmission of the disease down so that healthcare workers in whatever setting, in hospitals, in long-term care, in developmentally disabled homes, that all of those workers can have a chance at being healthy and not have the high risk of bringing that into the facilities.
All right, Marnie Pike at the Daily Herald will be our last question. Some Republican lawmakers have said the governor is going it alone on Tier 3 mitigations and ignoring the legislative branch. Can you comment on that?
I'm not ignoring the legislative branch. I talk with Republicans regularly. I'm glad to say the legislative branch has the ability to express itself, does all the time. I get letters, I get phone calls. The fact that the legislature hasn't met it's not my job to bring them together. In fact, the legislature has lots of responsibilities, and I have taken those responsibilities seriously as the leader of the executive branch in reaching out to their leadership, not just the 4 leaders of the 4 caucuses, but also to the leaders of committees, the ones who handle subject matter and have expertise, to get their input, and that includes Republicans. It's very important to me to get people on both sides of the aisle to express their desires, but not just to, sometimes people are just throw invectives and don't have any ideas, but they just don't like what we're doing. I want ideas. I try to reach out to the people who I think have good ideas on the other side of the aisle, just as I do on people on my side of the aisle. And indeed, I just would point out that one of the most important things that we put in place so early in this state, the mask mandate, was a result of a conversation with a Republican state representative. And I'm very pleased at the fact that he offered that idea. It was something important for us to do in the state. And I've had many other ideas that have gone into these plans. And so the people who are complaining are the ones who apparently don't want to reach out and actually have a conversation.
All right, thanks, everyone.
Thank you.
Votes shy, he's not gonna get it, so.
Now he's 5, I think, or 4 today.
Daryl, I'm sure they have.
Yeah, some favorite.